So we are paperless here most of the time. For admission forms and for the age, sex, species, and breed, and any known medical problems, you would pull up the patient's chart right here, and it shows you the type of dog it is, the age, spayed, female, how much it weighs, the color. If there are any medical problems, it would show a pop-up right here that we could put into our prompts and notes. We would just type in the medical condition or patient alert, and then we would save it, and it would pop up to the left right here in big red letters if they have a medical issue that we need to know about right away. So we can also look at all of this patient's previous medical records. We just click on medical notes, and it'll show us everything that they've been in here for. It'll show surgeries and dental procedures, if they come in just for vaccines, if they come in for an emergency, if they come in for annuals, sick reasons, that'll all show up over here. A few of them.
They track every order and help make sure your food arrives on time. For your next meeting, go to easycater.com or download the app. EasyCater, business catering made easy.
This is our anesthetic record. So we do, we explain what procedure they're going under for, anything that we're doing under the procedure. We have a good history. Blood work will explain right here what results are if the owner declined it. Our induction will let us know what we did to induce the dog and how much of it we gave and where we gave it. We have our endotracheal tube number, what size we did for that, where we placed our blood pressure, any post-op medications we gave, and total IV fluids that we gave. And then the doctor will usually type under the surgery section for a dental procedure, any kind of surgery, what we did and how he did it. And then this is where we keep track of all of our vitals during the entire surgery procedure. Our release and consent form, it will ask about pre-anesthetic blood work on here. It's authorizing that we can put the patient under anesthesia, that the client accepts all the risks or effects that could happen while under anesthesia. It says that if we need to, we can pick up their pet and have them transferred to a local emergency clinic. It also has dental procedures on here if it's okay if they can have teeth extractions. It'll have a client signature on it, the phone number that they can be reached that day. And then it also explains how we recommend doing a general health profile for pets that are older than the age of 4, and explains the CBC and everything that we're going to be checking while we're doing that blood work. So for a cage card for a patient, we'll include their first and last name, the date that they're here. We'll also include the procedure that they're coming in for. We'll classify whether they're spayed or neutered, male or female, the breed of the dog, and sometimes if we have the same breed of dog, we will write the color of the dog as well, or any specific patterns that could distinguish it from the other breed of dog. And then if there's a patient alert or medical alert that we need to know about the dog, whether they're aggressive or if they've got a medical condition that we need to know about, we'll write it under here real big and highlight it, so that's the first thing that we see whenever we're getting the patient out of the kennel. So for our laboratory forms, they will usually pop up over here. Any blood work that we've done will show up here. We usually ask for the consent that they sign off on lab work before any medical procedure whenever they sign the consent form. For our discharge instructions, we have just some home care instructions explaining that sometimes the pet will be tired for the next several hours and that they need to rest for the night. That when they get home to try offering a small amount of water first, and that if no vomiting occurs, then they can start with a small amount of food. We also explained to them that it's normal that if pets aren't interested in eating for the next 12 to 24 hours and that they shouldn't worry about it unless it's going on for a longer time. Exercise restrictions, we try to explain to clients to try to keep their pets restricted for as long as possible after going through a surgery. It'll also explain types of food that they need to eat. This dog had a cystotomy, so it's eating a urinary food that we scripted out, that we explained to the patient. It also talks about different prescriptions and medications we're sending home that day, when to start it, how much to give, and what type of medication it is. There's risks on there for excessive vomiting, diarrhea. If the patient won't want to take the medication, we ask them to call us immediately so that we can go from there to see what's necessary. We talk about wound care, try to keep it clean and dry, try not to bathe the dog, don't apply any medications unless directed to do so. It explains to not allow your pet to lick the incision. We stress that they need an e-collar if they continue to lick it or try to. If there are any swelling, discharge, redness, or the incision starts to open up, we have them call us immediately. We have the options for if they need a suture removal or when to remove bandages, and our phone number at the bottom if they have any questions or concerns. So this is how you hold for a jugular blood draw, and then a cephalic blood draw, and then a saphenous blood draw. Okay. Okay. There we go. You got it. Can you hold that? Look for the widest part right here of the animal. I'm not going to do it too hard. So pre-anesthetic protocols that we normally do, we would do buprenorphine, IM, and then Medicam. It helps with pain and inflammation and swelling. For inductions, we would do propofol sometimes on older dogs, or for dentals that we do, so it helps with a quick wake up. If it was a younger patient that we were doing a neuter or spay on, we would do a mixture of ketamine and midazolam that will help for a slow, calm recovery, and will also help with some pain management as well. So when moving a patient in or out of a kennel, you want to try to go slow and don't stick your head or face right in front of them, but just slowly open the door, lasso a slip lead around their head, and tighten it, and allow them to come out. And then to go back in the kennel, we'll just go back in. And I'll just slowly remove the lead. Safely when applying a muzzle, you want to hold the ends of the muzzle and you're gonna put the shorter part on top and the smaller part on bottom. You're just gonna place it right here and clip around the neck. When applying an e-collar, you really want to keep the loops away from the eyes. So you'll slowly put it over their heads. Watch out for their eyes and their ears. And there you go. So additional databases or tests that we would do on a sick patient could be lab work, which we would use on our Catalyst and CBC machine. We would also do radiographs here if we had a geriatric patient or limping for some reason, or if we had a dog who has a possible foreign body, we would do x-rays on that as well. If we have a dog in respiratory distress or needs to know blood pressures, we could do an ECG. So we're adding in our controls to our inventory. Buprenorphine, we did 0.35, and then we did ketamine 0.4, and then midazolam did 0.7 mLs. Okay. Parts of the anesthetic machine are the, you've got the CO2 absorbent right here, you've got the O2 flush, the inspiratory and expiratory valves, you've got the pop-off valve right here, this is the O2 flow meter, and the O2 gauge right here, and then you've got the oxygen supply down here. So the rebreathing and non-rebreathing systems are the exhaled gases that are circulated back to the patient after they go through the unidirectional valve to the carbon dioxide canister, and then the reservoir bag. Then they'll go back through the inhalation valve where that's combined with more fresh gas for the patient to inhale. So the pulse ox measures the oxygen level of the blood. The EKG, that checks for electrical and muscular function of the heart. The respiratory monitor will tell you how many beats the dog is breathing per minute. This is the blood pressure lead. It'll tell you the blood pressure of the patient. The temperature probe is what you'll stick down the patient's esophagus, and it'll give you the temperature, which we will demonstrate. And then this is the endotracheal tube. It maintains the patient's airway and ensures adequate exchange of oxygen and carbon dioxide. And you can determine what size to use by the nasal septal width of the dog or cat. To perform a leak test, we're going to close the pop-off valve. We're going to include the end of the anesthetic tubing with thumb or palm of hand. We're going to flush oxygen into the system. And the O2 manometer should read about 20 centimeters of water. We're going to hold and watch to make sure it doesn't drop more than 1 centimeter per second. And if that happens, then there's a leak somewhere. which our anesthetic machine does not have a leak. Here's my pulse ox. Boop. Here's my CG lines. So do right arm. Left arm, left leg, blood pressure, place my temperature probe too. Come over here. Okay. Right, good there. Preceptor, Dr. Nathan Sargent. Okay. Alrighty, let's just shade this up. Okay, use Chlorohex swabs. Clean it up. Make it more sterile. And grab okay. Wipe it off with some alcohol. Tourniquet, place that so I can occlude the vein. Keep roll it. Grab my 22 gauge catheter. Cap. So then, the hook tourniquet, place the cap, tape and secure the catheter. Flush it, see, make sure that it's in. And then bandage it up. Okay. Okay, that was good. Okay. So we're gonna do an IV injection. Just gonna use some saline. Okay. Okay, there you go. Pull back. Blood onto the tourniquet. Just slowly push it in. Induction.
Is that all you need video?
Yes. Okay, so I'm gonna shave from here up here. Keep the blade flat.
Maybe what we do is just show.
Oh. Okay. So scrub along the incision line and go out. Circular motion. This is our anesthetic record. So we do, we explain what procedure they're going under for, anything that we're doing under the procedure. We have a good history. Blood work will explain right here what results are if the owner declined it. Our induction will let us know what we did to induce the dog and how much of it we gave and where we gave it. We have our endotracheal tube number, what size we did for that, where we placed our blood pressure, any post-op medications we gave, and total IV fluids that we gave. And then the doctor will usually type under the surgery section for a dental procedure, any kind of surgery, what we did and how he did it. And then this is where we keep track of all of our vitals during the entire surgery procedure. not.
Mm-hmm.
Your arms up. Okay. I just need to fall. Hey, doctor. Okay. You said face it this way.
Mm-hmm.
Yeah, there we go. That's alright. You got it. Now the thumb's all the way over here. Okay, okay. Getting somewhere.
Very nice, very nice.
There you go. One down.
And without kind of like move your fingers up a little bit
Have it
more.
right at the.
You can use that hand and touch the gown. Yeah,
I can use this hand.
Yeah.
Okay.
there you go.
Maybe I think I had my fingers too.
Yeah,
far.
they were like way down
Are we
because
still
the
recording?
gown is swallowing you.
Are we still recording?
Yes.
Okay. Is
No,
this
yeah.
the right way?
Yeah, and just make sure the thumb will line up with the thumb, your thumb.
Easier. Okay.
So just grab that side. Okay, full turkey. Are you going? Okay.
This.
Yeah, right there. Grab it. Good. Now get your scissor,
Scissors.
and you're just gonna cut along this edge. Good. Just
Great. Okay. There's off.
are you clamped? You need to be clamped.
It is.
Huh?
Is it? It is.
Done?
Yeah.
Yeah, so what?
Guess we can just show that. These ones come out. Can't. Ew. Okay. So this is how you know when one's been sterilized, because the tape shows the darker lines on it. All right.
Reliable local restaurants. Check ratings and order online. Easy
Few
Cater's
of them.
5-star customer service team always has your back 24/7. They track every order and help make sure your food arrives on time. For your next meeting, go to easycater.com or download the app. Easy Cater, business catering made easy.
Finish.